I think the first step is acknowledging that structural and systemic barriers decisively affect an individual's well-being. And then further, they stand in the way of access to mental health care and support. For too long, we have been talking about very narrow definitions of mental health that are applicable only to certain kinds of people. Now, mental health as the process of foregrounding agency, control over life choices, access to education, public transport, public spaces, healthcare, workspaces, freedom from violence, from poverty and food insecurity is an economic, political, cultural, and critically psychosocial or mental health process. So I approach this work, professionally and personally through a few lenses, but I'm going to say that I also live with a mental health condition myself. Now, this always has to come with the recognition that my class and caste privileges in this country allowed me to access discourse, services, support, and most importantly, agency and choice in how I engage with my mental health. Let's not make a mistake. Of course, my not being a cis man has led me to issues and discrimination from male psychiatrists. But leaving that aside, more importantly, most people do not have recourse to the same things I've had. And so what does that mean in the Indian context is that systemic barriers and marginalization affect an individual's well-being and their ability to access support. And so we must understand that mental health is shaped by social, economic, material, and physical realities. And I'm going to call these structural determinants in the Indian context. And these lie on the axes of caste, gender, class, ability, and sexuality. And so it's very important to visibilize and account for how these structural determinants impact our contexts, our clinical work, community mental health practice, and of course, public policy. I think first is the understanding that, especially in the Indian context, and I would say in many LMIC contexts, that poor mental health is both a cause and consequence of poverty, compromised education, gender inequality, physical ill health, violence, and other global challenges. So for funding organizations, I want to say that mental health issues cannot be considered in isolation from other areas of development. Most funders talk the language of solution, finding a solution, addressing the challenge of mental health. I want to say that most people fall into two traps, and this is especially addressing marginalized communities and their mental health. The first, many funders have worried about the scalability of mental health and ultimately cited it as a reason for not funding. The second trap is to focus on scale via the trap of the lack of awareness or anti-stigma. After all, it's very great to say, let's do an awareness campaign and say, talk to someone, but when there is no one to talk to, you are wading into ethically dicey territory. And I'm actually going to say that there's a third trap. The idea of solutions itself is deeply flawed. People's movements, led, driven by the people, for the people themselves, and supporting multiple people movements, that's the answer to inequality, especially for marginalized communities. MHI as an organization, I think in our goals itself, the idea is that the whole system needs to be redrawn, and that's by foregrounding marginalized communities, because when you build systems for the margins, everyone gets covered. If you start off by building the system for the center, we're going to take a very long time to reach the margins. And the ways in which we are doing it is trying to work with multiple organizations who do work on the intersections of caste and mental health, religion and mental health, gender and sexuality and mental health. One of the training programs we run is called Queer Affirmative Counseling Practices, and that acknowledges how the PSY disciplines have been at the foreground of structural violence against those of marginalized genders and sexualities, and how do we redraw practice to be queer and trans affirmative? We have a few partners such as Yaol in Manipur, Rahi in Bangalore, who have been working for years without formal mental health sector intervention. Similarly, so for an organization called Anubhuti, led by NT activist Deepa Pawar, who has been doing fabulous work with NT communities and NT-DNT youth on mental health and empowerment. I think we're very lucky at MHI to be able to access such a wide range of mental health as well as other civil society activism that is very important to support in reducing mental health inequalities.